Welcome to Inside San Diego, where we take a personal look at all the hottest trends under the sun. On today's show, we'll have the most that San Diego has to offer in love, life, fashion, fitness, food, and all-around entertainment. Live from the studios at KUSI News, Inside San Diego.
And seeing is believing. That's what people who've had the latest vision correction procedure say. This morning, Dr. Yaghouti is here to tell us about a custom LASIK surgery. New advances mean there are many more options, surgical options, when it comes to patients looking to get rid of those eyeglasses. Dr. Yaghouti is here this morning to tell us more about one of the most current procedures. It's a custom LASIK procedure. Welcome.
Welcome. Thank you so much, Sandra.
Glad to have you here. You know, we've heard about LASIK, and LASIK has been around for 30 years.
Correct.
Why is this custom LASIK procedure different?
Very good question. Basically, LASIK has been around for so long, and many patients have chosen it as a vision correction procedure to get rid of their nearsightedness, farsightedness, and their astigmatism. Now, wavefront technology is basically the new advance of custom laser surgery. With wavefront technology, we now have the ability of really measuring precisely 25 times more the irregularities in the cornea.
So it's more precise?
It's more precise and accurate.
Why is it called waveform?
It's a very good question. Wavefront technology is where we send light through the eye and we get a wave pattern that comes back. And we measure that wave pattern. Every single person has a distinct wave print of their eye, a distinct wave visual pathway. With a distinct wave print, we can actually now treat that specific individual's eye uniquely, like a fingerprint of the eye.
Now, I've heard of people having certain eye correction techniques with a laser, and then years later having to go back to glasses. Does that happen with LASIK?
It can happen with LASIK, but a lot of those folks usually are above the age of 40, where reading starts coming into play, the age-related change of reading called presbyopia. For some patients with LASIK, you do find after a few years there will be some change, but the majority of patients, at least what the studies show, once we do the LASIK after the first year, most folks stay stable in their prescription.
So once you have a LASIK procedure, can you go back years later and have another one if you have some vision changes?
If the corneal thickness is correct, is there, and if there's plenty of room initially when you treat it, you definitely can.
So it really is a case-by-case basis?
It's a case-by-case basis, although the majority of people do have the ability of going back at least one more time.
Do you do both eyes at the same time now?
We do, yes. Before we did not used to, but now we find that it works better for patients. There's a greater balance for patients, and unless there's any issue, we don't have to worry about it in terms of the healing effect of the eyes.
And what about risk for people who are considering LASIK?
Nowadays, the risk is very, very rare. Most folks who do LASIK surgery rarely have any problems. They see well the next day, and there's no fear because there's no pain involved in terms of LASIK surgery.
And what about insurance? Do insurance companies cover this?
Not yet at this time. Most insurance companies understand that this is a cosmetic procedure, although many people have tried to talk to the insurance companies about it, but most of this is an elective procedure and no insurance coverage at this time.
Now you go in, you have the procedure. How long before you're okay to go about your day?
The beauty of wavefront technology is that within the first 24 hours, you're already noticing an advancement in your vision. In fact, I had a patient the other day who had high astigmatism at Global Laser Vision that never really could get laser surgery 5 years ago. Once we performed the custom laser procedure, the next day she was doing great. She had better vision than she's ever had before.
And what about cost?
Costs nowadays vary between surgical practice to practice in all places around the country. Usually the price ranges between $1,500 to about $3,000 per eye. At Global Laser Vision, we charge about $1,500 per eye.
Interesting. Well, it's always good to learn something new, health-wise, and
Yes, indeed.
something else to consider if you're looking for better vision.
Okay, thank you so much. Thanks for having me on.
Nice to meet you.